Hello and welcome to the pre-hospital ketamine talk. This talk was initially prepared by Ashley Bellinger over at Leicester EMS. It was adapted for the Holliston Fire Department by Assistant Chief Brian Kelly and narrated by myself, Jamie Eastman, one of the EMS coordinators and paramedics in the department. Thank you and welcome. Learning objectives for the pre-hospital ketamine talk today include, at the end of the session, we'll be able to discuss indications, contraindications, the doses, route of onset, duration of effects for therapeutic uses of ketamine. We'll describe the requirements as a paramedic to fulfill an order and to follow those appropriately in Massachusetts. We'll describe how we're going to communicate and document our usage of ketamine and what it was regulated and how it was given for the patient. And finally, we'll discuss and determine best practices for how to administer, when to administer, and then how to do your post-ketamine assessments and management. More specifically, our agenda today will include introduction. We'll talk about pharmacology, considerations, indications for use, our Massachusetts Office of EMS specific protocol, and our Holliston Fire Department standard operating procedure for ketamine. We'll go into our dose and our routes, our post-administration monitoring, and our communication documentation, specifically requirements by the state of Massachusetts, and our regulations and policies internally here at Holliston Fire Department. Introduction to ketamine. For years, ketamine's been used in the hospital. It's been used in veterinary clinics for animal patients as well. And you're going to see it adapted now here in the pre-hospital environment in Massachusetts for three major categories. One being pain control. Ketamine has both pain and sedation properties, which make it a great medication when used and employed appropriately. We'll talk about that throughout this whole talk to take care of pain and sedation. So pain control is one when it can't be reached by a drug with lesser pain properties. A lot of times fentanyl isn't enough on patients that have a high pain increase or high pain tolerance. It can be used for chemical restraint. We can use this if a patient is having excited delirium and needs to be calmed quickly with an intramuscular medication for their safety and the safety of the crews around them. And lastly, as we talked about, with sedation. So it has both pain and sedation properties and can be used appropriately in EMS for a lot of things listed here. Outside of pain control, chemical restraint, and sedation, however, you must have specific medical control direction here in Massachusetts. And for the Holliston Fire Department, that is going to be with the Milford Emergency Room physician. On call will be our medical control, and we'll contact them through Worcester CMED on a recorded line, either by phone or by radio. It's important to always tell you a little bit of history of the medications and their availability. So firstly, ketamine was developed in 1962 by Calvin Stevens, who's a PhD pharmacologist and medical scientist. And what he was doing was basically taking PCP, or more specifically known as NMDA, and adapting it to use as a clinical practice for patients to be used. He found that that medication caused what we call dissociation, which means it has multiple properties and can affect multiple receptors in the brain in order to give us the desired effect. That's where we talk about pain and sedation control. It hits multiple receptors, and it's very helpful for a lot of things in kind of a one-stop shop for medication in specific patient populations that we'll talk about continuously through this talk. So as we mentioned, there's a lot of usages for ketamine, and it has a wide net that can be cast in multiple locations. Like we said, in the battlefield, we can give it in the OR, we can have it for veterinary patients, but the pre-hospital environment, we have it very specifically, as you know, and it's a very controlled medication because it has such a wide usage. Office of EMS for Massachusetts specifically describes ketamine should only be administered to patients in the following situations: behavioral emergencies, adult; pain management, adult; sedation for intubation patients, which will not be utilized here in Massachusetts in the Holliston Fire Department yet until we have RSI; and then for patients with sedation and analgesia for electrical shock therapy in adults in cardiac. And any other usage outside of those will require explicit permission from all-ML control, which we said earlier for the Holliston Fire Department will be the Milford Hospital emergency physician on call, and will contact them through Worcester CMed on a recorded line via telephone or by radio. Very important, must be recorded conversation through CMed with the Milford Emergency Department physician for Holliston Fire Department.